Good evening, everyone. I am Dr. Ruman Afroz, General Secretary of the Australian Bangladesh Health Forum, ABHF. Thank you all for joining us today. We truly appreciate your time and interest. Today's webinar focuses on AMC exam details and job opportunities in Australia, and it is proudly organized by ABHF. Before we begin, I would like to briefly introduce our organization to you all. ABHF was born from a shared vision among a group of Bangladeshi doctors who believed that health professionals of Bangladeshi origin in Australia needed a common a platform where we could connect, collaborate, support one another, and contribute meaningfully to both our professional community and the wider society. Over time, that vision expanded beyond doctors to include dentists, pharmacists, nurses, allied health professionals, academics, and many others. Today, ABHF stands as a unified voice for Bangladeshi Australian health professionals, promoting networking, professional development, peer support, advocacy, and community initiatives. This webinar series is a part of our ongoing effort to share knowledge, guide newcomers, and strengthen our professional pathways within the Australian healthcare system. I would like to sincerely thank our speakers for their time and expertise and all the participants today for joining us. Your presence truly reflects the spirit of collaboration upon which ABHF was founded. Now, as we move forward with today's session, it is my pleasure to invite Dr. Samia Arifin, Education Secretary of ABHF, to share the aims and objectives of this webinar and to introduce our speakers and panelists. Over to you, Dr. Samia Arifin. Thank you.
Assalamu alaikum, everyone. Thank you, Dr. Rumana Afroz, for the introduction. I would like to warmly welcome all our participants joining us today for this important session on AMC exam preparation, exam details, and job opportunities in Australia. In today's webinar, we will briefly cover the AMC exam pathway, preparation strategies, and practical guidance on securing medical jobs in Australia, along with real-life experiences from our speakers. Please note that this presentation is based on our practical experiences. As there are frequent changes of rules and regulations, we strongly suggest that you take this webinar as suggestion and tips while making yourself familiar with any changes or updates which you can find on the official website of AMC. We are honored to have two excellent speakers with us today. Dr. Abhishek Bhadra, founder of AMC Mentor, who will share valuable insights into AMC exam preparation. Then we will have Dr. Helen Afroz, Senior Resident Medical Officer at Lismore Base Hospital, currently working in the Emergency Department. Dr. Afroz will discuss real-life job pathways and experiences. We are also privileged to have our respected panelists, Dr. Supriti Chaudhary, General Practitioner at Windsor Family Practice, and Dr. Toma Bishas, Senior Resident Medical Officer at Campbelltown Hospital. We will have a question and answer session at the end, so please feel free to write your questions in the chat box. Now, without further delay, I would like to invite our first speaker, Dr. Abhishek Bhadra. Over to you, Dr. Bhadra.
Hello, thank you. Uh, Thank you all. Hello, doctors. I am Dr. Abhishek Bhadra. I have been mentoring some AMC candidate for last 1.5 years. So I'm really happy and I'm really grateful to ABHF for this opportunity to share some experience and some our journey story in front of all of you. And so that's why, without further delay, I just want to start my today's presentation. And today I just want to share some of the strategy of AMC exams. So you all know you need to face some couple of exams in throughout your journey. So I will try to give a overview on all of them, and I will try to give you a deeper strategy of AMC MCQ. So if you have any questions or anything, just you can ask or you can type, and so we'll try to answer all the questions at the end of our session. So AMC preparation strategy breakdown. So you all know, who I know many of you are trying to prepare for AMC MCQ, or there you are planning for that. We all are in a journey. We can know it is a AMC journey, and we all know that if we or you pass the AMC exam, you will get the job. This is a very straightforward pathway, and but there are other story as well, like someone try to pass, or someone try to appear in the clinical exam before the getting job. So there's another way, and who are specific to GP pathway, or so they can sit for the PESCI exam and then they can get the job. So basically, before the PESCI exam, they need a job offer, and after passing the exam, they can join the job. So the thing is that before job, or you need to face on two, at least two, or sometimes the three exams. So these are the three exams: the AMC MCQ exam, AMC clinical exam, and sometimes the PESCI exam. So you sometimes you may face this exam. So before that, I can just try to give you an overview of all the formats. Like AMC MCQ exam, it's a computer based exam. It's 150 multiple choice answer question is there, and the duration is 3.5 hours, and you need to score 250 out of 500 to pass the exam. For the clinical exam, there is OSCE, like a structured clinical assessment. You all know about the OSCE. So it is OSCE type exam, and there will be the 16 station, and among them two will be the pilot station. So out of 14, you need to pass at least 9. So this is about the clinical exam format. And there is a PESCI. There are different organization, they organize the PESCI exam, like IME, RCGP, ACRAM. So it's all about, it's almost like the OSCE exam, but it is in the online, and it's something like interview. Sometimes you need to do role play with the candidate, or sometimes you need to discuss about the cases, and then they will assess your fitness to practice for that particular position. So this is the overview of all the exam, all the three exams you need to, or you may face throughout your journey. So now we'll try to give you an idea how to prepare yourself for AMC MCQ exam, because this is the, you can say it is a gateway. So everyone in the general pathway, that means a standard pathway, you need to sit for the AMC MCQ exam. So who are trying to prepare, or who are planning to sit for AMC MCQ exam, I think from this you will get some important information. So let's see the syllabus. So there is no fixed syllabus, but you need to finish, or you need to cover this system. Like you need to read all the medicines. So most of the important systems of the medicines, you need to read pediatrics and vaccination, you need to read the psychiatry, you need to read surgery including orthopedics, INT, you need to read the gynae and ops, CT imaging. For the CT imaging, you need to have a basic idea, and it's not like that you need to diagnose everything by seeing the image. It's like they will give you the clinical scenario, and by side they will give you some imaging. So that's really help you. It's not like you need to have a deep information or deep knowledge, but you need to have at least basic idea about that. You need to go through the medical ethics and some of the small system like biostat, pharma, drug interaction, like that. And now how to prepare, so that's the questions. So for the preparation, you have certain tools like you have some theory books like John Murtak, Kaplan series of book, and you have some online guidelines. There are some question bank as well, and the recalls is very important for this exam, and the mock test to prepare yourself. So if we try to see in details for books, everybody follows the John Murtak and the Kaplan series of A Step to CK USMLE. You know, there is a series of book from the Kaplan publication. So internal medicine, surgery, psychiatry, biostatistics is very important for that book. There is a AMC handbook from where you will get an idea about the MCQ exam. MCQ question, you will have an idea, but this book is little bit outdated. So be careful about the answer. And there is another book for 100 cases of medical ethics, which is very important for the medical ethics section. And for the guidelines, there are lots of guidelines in the Australia, but we mostly follow the RSCGP guideline. Sometimes the RC's guideline, the clinical guideline, SA Health for gynae and ops, and there is a therapeutic guideline, and Australian immunization website is there. So these all the guidelines is really helpful, and the very easy idea is whenever you go through any topics, just search it with Australian guidelines. You will get some links and you can go through that, and that will really give you the updated information regarding the Australian practice. And then you have some question banks. There are a lot of question banks, but I think Amadex, till now everybody suggests Amadex and it is enough. And for the psychiatry, you can my favorite was that you can read the UWorld psychiatry question banks only for the psychiatry is enough. And recall is very important, but here I would like to give you a suggestion. Don't rely on the recalls and question banks now, because there are some recent changes in the exams. There are some calibration changes, like they are as it is a computer based exam. So probably based on the recalls or completely relying on the recalls is dangerous for you, because it's a very expensive exam. So at least you need to have a very good backup or ground knowledge based on your book and guidelines. That will really save you in your exam. And another thing is that always think about a Australian doctor. For example, we all are graduated or completed our MBBS from our country. So we have different style of study. For example, we are really focused on some specific book, like there are some medicine books, and we try to follow that books line by line. But the thing is that sometimes you will be confused and your answer will be wrong, because the sometimes question asks like what is the next best step. So that will not match, and that the answer they will judge you based on the recent guidelines. So here the guideline is important, and you need to think about like you are sitting in the Australia in the emergency department on the GP center, and try to answer the question like that, and from that perspective, that will really help you to get more marks or increase your chance of passing in your exam. Now there is a timeline. It's just a basic timeline. 6 to 8 months is enough. And for you can divide this into two sections. First section you will fast for 1 to 4 months, or if you have more time, try to read all the textbooks and try to get an idea from the guidelines and start question bank system wise. So I think it is enough if you read 5 to 6 hours every day. By 4 to 6 months you will be cover all the systems, and then in the second phase you should repeat the question banks. This is just a suggestion. It's not like that you have to it's a guideline, not like that. It's our suggestion that you should repeat the question banks at least twice, and definitely it will be a great idea, and it will really help you to solve at least 6 to 12 months of recalls. If you have less of time or short of time, at least 6 months of recalls will be very important for your exam. And definitely you should try give some mock test, time bound mock test. It will really help you to get an idea for your timing of your exam. So that's all from my side, and it is very straightforward. Don't confuse, just try to try to get an idea from the textbook and guideline, and then solve the questions, solve the recall, and then you will really you feel the confidence, yes, I can do now. And definitely if you follow that, it will give you a very good result at the end. And this is absolutely, from my experience, it's not necessary that it is the ideal pathway or ideal suggestion. You can follow and modify that. And definitely we'll talk about the clinical and the test key exam in our following webinars by ABHF. So for that reason, you just keep a like in their Facebook page. You can like my page as well, so that you can get the information or updated information or further webinar notice. And that's all from my side. You can send any question this ABHF email. We'll happy to answer all the questions. So that's all. Thank you from my sides. Thank you.
Thank you, Dr. Bhadra, for your informative and helpful speech. It will certainly motivate and guide our participants today. I would like to encourage our participants to please write your questions in the chat box. We will address them during the question and answer session. Also, please know that this webinar is being recorded and will be made available for you to watch it again. Now, I would like to invite our second speaker, Dr. Helen Afroz. Dr. Afroz will discuss about real-life job pathways and experiences. Over to you, Dr. Afroz.
Thank you, Dr. Samia Arifin, and a lot of thanks to Dr. Abhishek for his excellent and elaborative presentation on AMC MCQ. I really appreciate ABHF for taking such a wonderful initiative for the Bangladeshi medical graduate who wants to work in Australian healthcare system. Securing first job is hurdle. It might drain you. At one point, you might feel that it's impossible. That's why we are here. We have gone through the process and we have succeeded. Hello, everyone. This is Dr. Helen Afroz. I am working as a senior resident medical officer in Northern New South Wales Health, Lismore Base Hospital. And today my presentation will be focusing on job application and how to find the job and the pathways. So let's start. Among the different pathways, today I'm going to give an overview on the standard pathway and competent authority pathway. So initially, first thing I'm going to tell you about the competent authority pathway. And the key points are, like that requirements are medical college degree that is recognized by Australian Medical Council and the World Directory of Medical School. Passing their license exam of the specific country like Canada, USA, UK, New Zealand, Ireland, and having a 12-month work experience over there. Then you need to find the job offer. And when you got the job offer, you will apply for the AFRA registration. AFRA is the Australian Health Regulatory System. So now I'm going to discuss about the standard pathway, and our main focus will be on this pathway. So the requirements are medical college degree recognized by Australian Medical Council and the World Directory of Medical School, passing of AMC MCQ examination, English proficiency. You can have either IELTS, you can have OET, or you can have PTE. Then you have to have the job offer. There is two different types of job offer or job pathway. Like if you choose hospital pathway, you can go through the hospital pathway. And if you are following GP pathway, you can go through the GP pathway. So a GP pathway will be discussed in our following webinar. Now we are discussing about the hospital pathway. In hospital pathway, there are a couple of steps. First thing, securing job. Second thing, apply for AFRA registration. So there are a couple of types of registration. If you have both AMC 1 and AMC 2, that means AMC clinical, you can apply for a provisional registration. But if you only have AMC part 1, with the English test, then you can apply for limited registration. The issue is the limited registration is you can work without any hesitation, without limitation, but the limitation is there that you can renew the registration only for 3 times. So what you need to do in the meantime, you have to complete your AMC. You can complete AMC by doing AMC clinical examination, or you can go via work-based assessment. So what is work-based assessment? There are a couple of hospitals throughout the Australia that provide the opportunities of work-based assessment. It is a like 6 to 18 months duration of a assessment. It varies from hospital to hospital, and also it varies in duration from hospital to hospital. So how you can get enrolled in the work-based assessment? So you have to have the ongoing job offer with that specific hospital, and they also have their own waiting period, and it also varies from 6 to 2 years, 6 months to 2 years. Okay, and with this time you have to complete your required rotation for 12 months, like, and in the specific department, like you have to have your rotation in general medicine, you have to have your rotation in general surgery, and you have to have another rotation in emergency department. So 3 specialty is mandatory. After completing all this, you will apply for general registration, and when you got the general registration, you are free. So you can go every pathway, like you can choose basic physician training pathway that will lead you to the specialist. You can choose GP pathway or GP fellowship pathway, whatever you want. So now I'm going to second part of my presentation, that is job applying. So how you can apply for the job? First thing, finding job circular. Second thing, strong and structured CV. Third thing, apply in a proper way following job description. So in every job circular, there is a separate box that will describe the job description, that will have the job description for the designated job. You need to follow that, and you need to apply according to that. And fourth thing, response to the selection criteria. This is one of the key factor, and your possibility to getting the job mostly depend on your response to the selection criteria. And the fifth thing is a cover letter. Some hospital asks for the cover letter, some hospital doesn't ask for the cover letter. So what is cover letter? Cover letter is like 1-page summary of your CV. Now come to the CV. So in case of CV writing, I would suggest you to follow the AFRA CV format that you can find in the AFRA website. They are very specific and they are very pointed, clear cut. And regarding CV, I'll just give some tips in like CV writing. So please don't overburden your CV with putting some photos, unnecessary certificates that you have achieved throughout your life, unnecessary description. So your CV should be highlighted according to your job application. Like if you are applying for your emergency position, you can highlight your emergency experiences like ALS, BLS training. You can put that like highlighted. If you are applying for a psychiatric position, then you can highlight your any psychiatric job experience, like in a psychiatric first aid, what you have done, how you deal the complicated patient. You can put that. And the third thing, there should be no grammatical error. There should not be any spelling mistakes. So you can double check your like CV with your friends or your colleague and tailor the CV according to the job description. And if you have any clinical gap, you can clearly explain in your CV. Next part, selection criteria. So I would suggest you to be more focused on your selection criteria following the STAR approach. And there will be 8 to 12 point. It varies in every job description and in every job requirement. So there are some 3 or 4 types of questions like personal strength, conflict resolution, clinical scenario, and there could be some ethical question. I would suggest to give your real life experience following this STAR approach in your selection criteria and that the situation that you have handled. Okay, thank you. Next one. So in Australia, there are different states and territory. Each state and territory have their own job circular, and they are also like centralized recruitment, and there is also individual recruitment. So you need to follow each and every state, and you can also find the job in different websites that I can share in the chat box if you want. And so you can, how you will find the circular? You can find the circular in those websites, Seek, Indeed, Jora. So you need to make your own account in those websites and click on the notification button. So whenever there is any job circular, they will send it to you. So before I finish, I would just give you some tips, and it is one of the hurdle, like you have to be very proud to get your job. This is one of your challenge, that be consistent, apply everywhere, every job position, and try to find your observership if you are in Australia. Finding observership, you can find it maybe in the hospital or maybe in the GP center, and you can find some observership. Those are paid, some are unpaid as well. So all these observership, they also circulate, and you can find it through the websites. And if you get the position in your observership, try to work hard, show them that you are competent, make communication, and also good relation with them. And in New South Wales, there is one observership program that runs for the PR and citizen, that is called International Medical Graduate Clinical Readiness Program, that is free of cost. And if you are in Bangladesh, try to maintain the recency of practice and obtain written certificate and proof where you are working, and engage in some CPD activities like ALS, BLS, APLS. And while you are applying, you can prepare yourself in ahead, like you can go for national police check, you can go for international criminal history check, you can update with vaccination, immunization, you can have your working with children certificate. And the last key point that I'm going to describe is it's the reference. So try to find 2 to 3 good referees from where you are working who will check the email and reply for you very quickly and promptly. And try to find the email address or call to the medical admin of that hospital of your interest or in your locality. And just be mindful that rules can be changed at any time. What I am discussing today based on my clinical, practical experience. So please have patience, keep applying. Best wishes for all of you. And our next session will be question and answer session. Thank you so much.
Thank you, Dr. Afroz, for your excellent presentation. I hope it will be very helpful for our participants in their AMC journey. We will now move on to the question and answer session. We have received a number of questions from our participants already. I'll go through them one by one, and our respected panelists and speakers will be answering these questions. We will try to answer as many questions as possible during this session. If we are unable to cover any question due to time limitation, please feel free to reach out to us via our email. Our email address is abhealthforum@gmail.com, and we will get back to you. I would now like to invite our panelists, Dr. Supriti Chaudhary and Dr. Toma Biswas, to share their insights and to respond to your questions. As I said before, our speakers will be available as well to answer to your questions. Okay, so let's begin with our first question now. Our first question is, I am working as a consultant of surgery for last 4 years and more than 15 years of clinical experience. Recently have completed AMC MCQ at last November. Now residing at Adelaide and seeking for a job. Need your guidance to secure a job in current situation. I would get Dr. Shupriti Chaudhuri to answer, please.
Thank you. Congratulations for to passing the MCQ exam. So you already started your journey in Australia. So the first step is done, and if you complete your OET or English proficiency exam, then you can apply the work through all the campaign that Dr. Afroz actually showed her slides. I used to actually call all the hospitals and send all our CV. So that's another approach you can apply on apart from the campaign, because usually in the first campaign, it's quite difficult for the IMGs to secure a job. But after when the first campaign was finished and the second campaign, there is a more chance to get the job in for the IMGs, and you can apply and you can contact the hospital, especially if you are in Adelaide. I will advise you to contact all the hospital, especially Mount Gambier, and to get observership. There is a chance to get observership in the Flinders Hospital, as I know. Some of my colleagues, they got observership and then they secured a job in there. So just call and apply all the state and all the campaign, and hopefully you'll get a job. Yeah, that's all. If you have any other, if you need any help, you can always send us an email. We'll happy to help you. Thank you.
Thank you, Dr. Shupriti. Our second question, when can we start applying for jobs after AMC Part 1 or after AMC Part 2? What are the common entry-level jobs after AMC Part 1? I guess Dr. Toma Bishash will be interested to answer these.
Yes, I can answer that. Thank you, Dr. Arifin. I would say that when you start applying for the jobs, the main criteria that you have to fill is that if you're eligible for any sort of AFRA registration. And to get the AFRA registration, you have to be eligible for either the limited or the provisional registration. And for the limited registration, you can apply after passing AMC 1. So you don't have to pass AMC 2 when you start applying the jobs. AMC 1 is is all that you need, but you also have two other requirements. That is, you have to pass the English language test, so either IELTS, PD, or any other sorts. Those are acceptable, and also you have to have the recency of practice. I would say these three are the main criteria. And you can even start applying after your AMC Part 1 and then get into this, start getting to know the system, how to apply before you can even pass the English language test, because those are the requirements you need when you are applying for the AFRA registration. However, if you have already passed the AMC Part 2, then obviously you'd get like better chances at getting job, because then you can apply for your provisional registration. And if you work in the Australian healthcare system for 1 year, then you can directly apply for the general registration. And the second question, the common entry-level jobs after AMC Part 1, usually the most common ones are joining as a resident medical officer, RMO, senior resident medical officer, SRMO, unaccredited trainees, or any sort of like other registrar positions. Usually it will also depend on your clinical experience. So if you have like decent experience, especially if you have at least completed your internship, you can apply for the RMO positions. And if you have like at least 2 or 3 years of experience, then you can start applying for the SRMO or unaccredited trainee positions. There are also some intern positions available that you can apply. However, those are usually a bit like hard to get. However, I would say like apply everywhere, like every position, because if you are applying, if you do good with the interview, or if your CV is very eye-catching, they might even like consider you for the like next positions available. So I would say like apply everywhere, but mainly RMO, SRMO, unaccredited trainee. Those would be the preferable ones, and especially emergency departments because they need lots of doctors and usually they're very short staffed. So ED would be a great priority for first job.
Thank you, Dr. Toma Bishash. Now, moving on to our third question. How should we prepare for behavioral or scenario-based questions and for interviews? I guess it's again, we're gonna go back to Dr. Shupriti.
So it just you when they ask you a behavioral or real scenario question, you just need to when you work in the ward, whatever you feel like, you need to just give a scenario just in case sometimes they ask about the conflict question, like if you have a conflict with your colleague, how do you solve that? Or if you have a conflict with the nurse, what you are going to do. So I think Dr. Afroz actually shows a approach like a star approach. I think you will fit the full scenario on that, and you will actually complete the question, and you will answer the question. And another the behavioral another is if how you can manage a aggressive patient. So in that case you just need to go through all this ABC approach, and then ask for help and what you did, because if you are going to work in a RMO, so you will be the junior doctor, so to get the help from the senior and to be safe in the ward and to be safe for you and for the patient, you need to get a help from them, so that they want to know how safe you are in all these behavior question and then or the incidental question. So yeah, you just prepare something from your real life and then answer that question.
Thank you,
Thank you.
Dr. Shupriti. Now, did anyone wants to add some more on this question, or should we just move on to the next one? Okay, so
I can have like if we are answering the scenario based questions, sometimes like they would give you a like clinical scenario like this year old like male or female coming with like abdominal pain or also maybe some investigations or some vitals. So I would say like always like answering those questions usually preferable to answer by following the ABCDE approach. Like initially like we have to make sure that the patient is like stay hemodynamically like stable or unstable, and then we'll go by the like ABCD, like making sure the airway and then breathing, circulation, disability, exposure, and then fluids or glucose. And after that like depending on what we find, like we would also like manage those things simultaneously like primary survey, and then we'll go into like secondary survey, and then we'll try to do at least the basic things like send the bloods, because in Australia usually like if we are working in hospitals, it's very common that like we can send the bloods quickly, we can do like IV cannulas, and then like start at least a supplemental oxygen or other immediate like management steps. And second thing would be that like doing the initial things and then escalate to our like seniors like registrar, consultant, or whoever is available on site, and then discuss with them, and also communicating back to the nurses and like other staff who are involved in the management of the patient, and also communicating to the patient and to the family, and explaining the plan and the situation, and then going from there.
thank you, Dr. Thoma. I would go on to our fourth question. Is coaching necessary for AMC clinical exam? I guess again, you, Dr. Thoma.
Yes, I would say preparing for the AMC clinical exam is a bit different from the AMC MCQ exam. And even whoever is already working in the Australian healthcare system, sometimes the clinical exam might not be so like easygoing that you go to the exam and then like you pass, because it needs actually like a lot of preparation and then knowing the healthcare system, especially like how in Australia it works, and especially the time limitation is a major concern, and then how to address the tasks in a timely manner, because like you might know a lot about the scenario, or in your workplace like you would be able to manage the scenario. However, it's very important like how to address those in an exam scenario. Even you'd see that like the registrars or who have if like broad experience in that specialty sometimes might fail even those stations, because they are uh, assessing the knowledge of a doctor after completing like PGY1, and also how to address those things. And then the exam itself has like some special key points. Like if you have touched like all of the points and many things, however, if you miss like maybe some key points, that's called critical error, you will fail the exam. And then like you will fail the station. And then also like there are tasks, a few tasks like mentioned, and you have to address like each of the tasks. So if you forget to mention maybe a minor or small task that would take like few seconds, but if you have missed it, like you would like fail the station. So I would say it's not like absolutely mandatory to do a course for the clinical exam, but it's very useful, especially if you haven't worked in the healthcare system, or even if you have worked. I think it gives you like better idea how to address those things, and especially for the physical examination. I think like previously there were like online exams during COVID, but now it's all face to face. And then especially with the physical examinations, how you have to like address those, I think like getting a course or face-to-face like courses could be very helpful. And however, I would say for even before before, I would say like comparing to the courses and uh, having a partner, like a study partner, I would say for clinical exam is very important, like practice, practice, and practice, and managing the time, and then like making sure you are like addressing all of the tasks. So it's hard to say, but however, I would say like it's preferable that if you can do a few courses and also have a study partner, that you can like role play all of the cases, and then um, uh, revise the recalls.
Thank you, Dr. Toma. Our next question. I am in Adelaide with over 3 years of work experience. I will sit for the AMC MCQ exam this year. I am on a subclass 500 visa as a dependent of a master's student, and I have a full-time work permit with no restrictions. Does this visa condition matter for getting the job after part one? Any regional area preferred to get a job after part one? Um, I think Dr. Supriti will answer this question.
Yeah, thank you. So I don't think so. The visa criteria is a problem to get a job because you are on full work permit, and once as we said before, after you complete your English proficiency exam, you can apply through the campaign and apply for the job, and that's not going to be a problem for you. You just need to apply MCQ. If you have a clinical gap, sometimes there will be a possible there will be a bit hard, but if you do some internship, if you get some in observership, some in the hospital or from in a GP clinic, that will help as well. But yeah, just need to apply. Thank you.
Thanks, Dr. Supriti. Next question. Can you please show an appropriate CV structure and cover letter? I guess just to answer that question, it is really kind of person to person, varies on person to person, and really specific. And there is sort of like privacy issue. So please send us your CV or cover letter if you are prepared, and we will have a look at it and get back to you. Our next question.
The simple thing is that there is a AFRA format of the CV. If the candidate and doctor just search the AFRA format of the CV, it is available in a Word format, and I think it's a very good guide to prepare the first CV if anyone want to prepare his first CV or cover letter.
Yeah, thanks, Dr. Bhadra. Our next question. Is it possible to get job from Bangladesh? What is the real scenario? If I want to go to Australia after passing only AMC Part 1, what will be the procedure? What type of visa need to be applied? Dr. Helen?
Yeah, thank you for the questions. So first thing, like definitely you can apply for your after AMC 1 from Bangladesh. There is no restriction of application, but you have to have, I have described in my presentation that you have to have AMC 1 and also English proficiency. If you have AMC 1 and English proficiency test pass, you can apply for job from anywhere in the world. And the job situation, yes, it's I would not say that it's really easy to get job here in Australia. It's time consuming. You have to be very like consistent with application of the job, as I have already described in my presentation. And saturation, yes, it's not that much saturated in UK, but I would not say it's that easy to get the job. It might take time, but it also depends from person to person, vary from individual to individual, and also depends on your clinical experience and also your CV, your approach, everything. And regarding the visa, if you got the job offer, then the hospital will provide you the sponsor visa, and that is called sponsorship visa. Thank you.
Thanks, Dr. Helen. Our next question. Do we need Australian clinical experience before applying? How important are referees and who should we include? Again, I guess it's Dr. Helen to answer.
Yes. Thank you for the question. And it's not mandatory to work here before, like you don't need to have the Australian clinical experience. You can apply from anywhere in the world. So just have to have AMC 1 and also the English test, then you can apply. And yes, referee is a crucial thing, because you have to have at least 3 referees. Some job application they want 2 referee, some always ask for 3 referees. So I would suggest you to have at least 3 good referees. If you are in Australia, I have already described in my presentation that try to find out observership, and while you are doing the observership, you can communicate with your clinician consultant, and you can or you have your supervisor, so you can use them, you can request them to work as a referee. And if you are in the GP center, your GP can be your referee as well. But if you are in Bangladesh, try to have recency of practice, continue your clinical work, and try to have the proof that you are working, and try to have your consultant or your professor, whoever you are familiar with, whoever is helpful, whoever checks your emails regularly, you can have them. So referee is very crucial. Thank you.
Thanks, Dr. Helen. Our next question. I am recently graduated doctor from Bangladesh, having completed my internship this year, and I am currently preparing for the AMC Part 1 exam. I plan to apply for the RMO recruitment cycle next year. Could you please share the current job situation for doctors in Australia? Is it becoming as saturated as the UK? I would also appreciate any advice on how to improve my chances of securing a job. I am open to all locations and interested in pursuing general practice. I guess, Dr. Helen, you have already answered part of it, but I would leave it on to you to answer.
Yeah. Thank you so much. So as I have already mentioned, so you have to have your aim. If you go through my presentation, you have to have AMC 1 and you have to have the English test. Then you can apply for anywhere from any part. And the job situation, yes, I also discussed that it's not easy, but it's not that much difficult. But you have to have patience. And if you apply for the rural area, uh, it's possible if you get chance in your hospital job, rural job, or you can get your GP offer from the rural area. Sometimes it's helpful to get the job in rural area. So keep applying. You don't know wherever you will get it, so keep applying.
Thank you. Our next question. I am a consultant anesthetist. I completed diploma anesthesia. Now in government job, how it will help me to apply? Dr. Sajidul Islam will answer this question.
Thank you for the question. I think it's a very critical question, and we will have a special session on specialist pathway down the track, how the specialist can come to Australia with the Bangladeshi degree. But unfortunately, the degree you have in diploma, I think it's mostly you need to have an either FCPS or MD, that means doctor of medicine degree in the subspecialty to apply for the specialist pathway. But if you want to go to general pathway, I think you can. And you have a bit of an advantage to apply for the general pathway because you have the degree of anesthesia. So I would strongly recommend you go for the AMC Part 1, do the your English, and then obviously when we have our next session on the GP pathway for pesky and go to the rural, I think you are a good candidate for rural clinician to work as a GP in the rural, or you can work as a GP in the city. But a specialist pathway as an anesthetist coming from Bangladesh will be slightly complicated, but we will discuss it later on, I think. But you have the great opportunity if you have the MC Part 1 and English. Thank you.
Thank you, Dr. Islam. Our next question. I am currently preparing for MC MCQ. I have got CLAB 1 and CLAB 2 and full GMC registration and have got 4 or 5 months of NHS experience. I'm not sure what NHS is. My question is, for my first job in Australia, can I apply for level 2 supervision, or with AMC1, can I apply for level 1 supervision? I guess Dr. Helen would be answering this.
Yes. Thank you for the question. As I have already mentioned, you have to have the GMC registration. You can come from England, like UK, to Australia if you have the GMC registration. And yes, you can apply for level 2 supervision, but I would suggest complete your 12 months rotation over there or 12 months working over there, then apply for Australia. Because if you want to get level 2 supervision, if you have 12 months of work experience in NHS, that would benefit you. And the other thing is that if you are applying for currently for 4 to 5 months experience, after sometimes after varies from person to person. They might not allow you for level 2 supervision. They might put you on level 1 supervision. There are a couple of hospitals, those take the doctors with level 1 supervision as well. So keep applying, but I would suggest to finish your 12 months rotation over there, then plan for Australia. Okay, thank you.
Thank you, Dr. Helen. Our next question, how can I get a job as a GP after AMC1? I would like to get Dr. Bhadra to answer this question.
Thank you. Thank you for the questions. So after passing AMC on, you have to search for the GP positions. Like the same way the hospital, you can contact to the GP centers for level 1 position job offer. With that job offer, you can apply for the PESCI. You need to clear the PESCI exam, and then you can directly start the GP level 1, mostly level 1 position as a in the GP practice. I think this is the straight way if you directly go to the or build your career as a GP.
Thank you, Dr. Bhadra. Our next question. Can we sit for AMC Part 1 from Bangladesh? What are the best resources or books, question banks for AMC MCQ preparation? How many hours per day should we study for AMC Part 1? I believe Dr. Bhadra, you have already answered part of these questions, but I would still go back to you to answer this.
Okay, unfortunately from Bangladesh, you can't sit for the AMC Part 1 exam. So in our previous webinar, webinar 1, we give all the details from where you can sit for the Part 1, or everything is there. And in our today's webinar, we discuss everything regarding your preparations, and what I have mentioned, it is enough for self preparations. And even if you have any planning, you can take any coaching for the support. Otherwise, if you follow this, I think it is enough to prepare yourself and to pass the exam. So you just see all our webinars recording. I think that will be helpful rather than repeating everything. Thank you.
Thank you. Thank you, Dr. Bhadra. Our next question. Is it possible to get a job without connections or references? How do we manage financially during the preparation period? What visa pathways are available for doctors? Dr. Islam will answer this question. Are you there, Dr. Islam?
So if I answer the question, part of it, I think Helen can or someone else can part of it. Do you need a connection to get a job? No, you don't need a connection to get a job. It's a fair process in Australia, so it is a merit-based process. It's not linked with any connection, but obviously, if you have a good chance to get an observership somewhere, that actually helps. So yeah, if you get an observership, sometimes you need a connection. Second thing is, how do you financially survive? Most of the doctors here work as a phlebotomist or assistant in nursing or whatever job they do, what to do to survive, they do that to run the show. But I don't think with the current market situation, financial situation is not enough to earn the money to run the show and the whole thing. So that means you can't study and get the money and you can't give the exam because the exams are very expensive and all those things, if that answers the question. I've missed the third part of the question.
Do you want me to repeat it?
That's the third part.
What visa pathways are available for doctors?
There's no visa pathway available for doctors, unfortunately. You have to either come as a student visa or you have to come as a temporary visa to visit and give the exam for part 2 and then apply for the job. But you cannot work. There's a work restriction on that particular part. And the third option is if you get a job and the employer sponsor you and bring you from Bangladesh or you're in Australia. So unfortunately, the only 3 pathways, but no visa category for doctors. I think there is a webinar on that in our first or second webinar. It is clearly instructed by that migration agent that there is no doctor's category visa in Australia.
Thank you, Dr. Islam. Our next question.
Sorry, Apu. I just want to add, yes, Dr. Islam was right. In the second webinar, I think we have discussed regarding the visa issues. So I would suggest to go through the visa agent. Actually, what Dr. Islam said, there is no specific visa for doctor. So you have to follow that webinar for different options. Thank you.
Thank you, Dr. Helen. Our next question. I am currently in Bangladesh studying for AMC 1, completed my internship 1.5 years ago. I am not in a clinical practice right now. I'm working as a lecturer in a medical college. What path will be better for me considering my circumstances? I'm planning to pass MC1, start clinical practice, and give PTE and apply for jobs. In the meantime, I'll prepare for MC Clinical. Is there any better approach? I guess Dr. Toma would be the best person to answer this.
Yes, I can answer this. I think like what the plan that she has mentioned is pretty good. However, I would say that passing the AMC Part 1 would be the crucial step here. And in the meantime, if they can start the clinical practice, that's very good. Otherwise, if they can like pass a AMC 1 as soon as possible, even with that 1.5 years of gap. So if you have a clinical gap, it's not the end of the world, because if you have done your continuous like professional development, because you were already working as a lecturer, so that is a very like good thing, because like it's not like you were not working at all, or you were not involved in the medical practice at all. So you can mention those, and then if you have done other like courses or other things, and you were already like involved in teaching, that is a very like good like strong point. And also like when you are preparing for the AMC Part 1, if you can simultaneously complete the English test, then I think like you would be like eligible to apply for the job, and then apply for the limited registration straight away. And in the meantime, like you can also do some like courses to enrich like your experience and enrich your CV, like doing maybe the advanced life support, the basic life support, and some like few other like relevant courses. But I would say like it's a very pretty good plan anyway. Yeah. Thank you.
Thank you, Dr. Thoma. I guess I would just like to add on to what you have said is, I mean, we will have a separate webinar, I believe. ABHF will organize another webinar on the academic pathway. So keep an eye on our page and there will be updates on it. Our next question. I have FCPS in surgery. Can I apply specialist pathway? I guess as Dr. Sajid said, we will have another webinar on specialist pathway. So please keep an eye on our website for updates and dates. Our next question. If I don't get job offer from Bangladesh but want to go to Australia for observership or clinical exam, then what to do? Dr. Thoma?
Yes, I would say like if you don't get the job offer, like you can come to Australia for clinical exam. But I can be wrong, or I don't have the like complete information. But from what I know, that like for the clinical exam, you would only get a visitor visa, and usually you won't be able to stay in Australia to continue like working or do any other stuff, and you have to go back. And for the observership also, I don't think like they give like specific visa for observership. But if you come to Australia with like any other visa, like Dr. Islam mentioned, like either like study visa or spouse visa or any other sort of visa, then obviously you would be able to apply for the observership. Thank you.
Thanks, Dr. Thoma. Our next question. If I complete AMC1 and apply for rural area with diploma in anesthesia, is it helpful for GP job? Dr. Helen, did you want to answer this?
Yes, like the question was, yeah, I got it. Yeah, you can. The thing is, the basic thing is that like you have to have the AMC one, and with the diploma, yeah, it can help you to get the job, but separately, actually, there is I would say there is nothing like you will get entry in your anesthesia job, but yes, AMC one English test and get offer for a GP position, then you have to go through the PACE pathway that we have already like we have another webinar coming on GP pathway, so you can stick on that, and it's not impossible, but you can have a look on our next webinar for more details.
Thank you. Our next question. I am in rural Western Australia and have passed AMC MCQ and English tests. Is PR required to get a hospital job, or can we work on temporary visa? Also, how can I arrange referees without Australian experience? So Dr. Shupriti will answer this question.
So you doesn't need any PR to apply for the hospital job. You can work on temporary visas. In terms of the referees, so you just need a 2 to 3 referee who from Bangladesh, who can actually answer if they from the hospital if they want to contact them. So they can apply. They can reply their email. So 3 active referee should be from Bangladesh would be good.
And I guess just to answer on to you to answer this question, it is important. You are in Western Australia, and it's important to do CPD and whatever like sort of courses, so that you are like more sort of the currency is there, so they won't ask you to explain why there is a gap in between application and in between you been coming in here in Australia. Yeah, our next question. Does the hospitals or GP clinic sponsor visas? Dr. Helen, you want to answer this?
Yeah, so actually, both the GP and hospital, if you get the job offer, they will give you the sponsor visa. So you have to have the job offer. So whenever you get your offer, then a GP center will give you the sponsor visa, and also the hospital will provide you the sponsor visa, and you can come and work here.
Okay. Before we go on to our next session, you can all see on the screen that our next webinar is our 4th webinar of the series, and that will be on general practice pathway for IMG in Australia, and it's going to be held on 22nd of May. So we're going to move on to our next question. I am on student visa and preparing for AMC clinical now. Can I do observership while on student visa? Dr. Abhishek will answer this question.
Yes, you can, but just for your safety, just have an idea. You have 24 hours per week work right or like that. So you have the permissions. So if you have any part-time job or anything, just try to maintain that 24 hours, including your observership and your part-time job. I think that is very important. Otherwise, yeah, yes, you can, like any job, you can do that. Thank
I'm
you.
just waiting for the next question. Otherwise, we might just come to a conclusion.
Oh, okay. Can I take just one question from here?
Yeah, sure.
Okay, so someone said that I have failed 2 times in AMC1. Should I go for the another attempt? Yes. The thing is that it's completely depend on your planning, or because if you really want to come Australia and you want to practice here, so I think it's not about time 2 times or 3 times. As many times you need to sit for the exam, you should go for that. But the thing is that try to analysis, take a pause, talk to the different person, and try to find out your what is the problem in the previous time, why you fail, and try to work on that. I think you will be passing that third time. So good wishes for you, and go ahead. Thank you.
Thank you, Dr. Abhishek, for picking up that question. Now we are at the end of our webinar. Due to time limitation, we will need to conclude our session here today. Thank you all for participating and for your active engagement throughout the webinar. We truly appreciate your time and interest. As mentioned earlier, if we were unable to answer any of your questions, please feel free to email us on abhealthforum@gmail.com. We will review your question and get back to you as soon as we can. We are also pleased, as I mentioned before, like we have the next webinar on the 22nd of May. Please keep an eye on our page for further updates and registration details. Thank you once again. Allah Hafiz and good night.